Come to the podium. Let's listen, Beth.
COVID press conference. I'm joined, I'm delighted to say, by Chris Whitty, the Chief Medical Officer, and by Andrew Pollard, who's the Director of the Oxford Vaccine Project. It seems that almost every week we learn of some new scientific breakthrough to help us beat COVID. Last week it was good news about the vaccine from Pfizer-BioNTech and then Moderna. This morning we heard the fantastic news that the Oxford AstraZeneca vaccine has been highly effective in clinical trials. There are more tests to be done, but the signs are that this vaccine, financed partly by British taxpayers working in partnership with a great British company, this vaccine could be both affordable and easy to use and highly effective. We've ordered 100 million doses, and thanks to the work of the Vaccines Task Force, we've secured more than 350 million doses of potential vaccines of all kinds. But we are not out of the woods yet. We can hear the drumming hooves of the cavalry coming over the brow of the hill, but they're not here yet. Even if all three vaccines are approved, even if the production timetables are met, and vaccines notoriously fall behind in their production timetables, it will be months before we can be sure that we've inoculated everyone that needs a vaccine. And those months will be hard, they will be cold, they include January and February, when the NHS is under its greatest pressure. And that is why when we come out of lockdown next week, we must not just throw away the gains we've all made. So today we've published our COVID winter plan, which sets out a clear strategy to take the country through to the end of March. We will continue to bear down hard on this virus. We will use tough tiering, in some ways tougher than the pre-lockdown measures, and details of those tiers are on the gov.uk website. And later this week, when we have the most up-to-date data, we'll be sharing details of about which tier your area is going to be in. But I should warn you now that many more places will be in higher tiers than, alas, was previously the case. We will simultaneously be using the new and exciting possibilities of community testing, as they've done in Liverpool. And there will be a clear incentive for everyone in areas where virus prevalence is high to get a test, get one of these rapid turnaround lateral flow tests, do your best for the community, get a test to help to squeeze the disease and reduce the restrictions that your town or city or area community has endured. And that way, through tough tiering and mass community testing, we hope to let people see a little more of their family and friends over Christmas. Now, I know that many of us want and need Christmas with our families. We feel after this year we deserve it. But this is not the moment to let the virus rip for the sake of Christmas parties. It is the season to be jolly, but it is also the season to be jolly careful, especially with elderly relatives. And working with the devolved administrations, we will set out shortly how we want to get the balance right for Christmas, and we'll be sending that out later this week. Christmas this year will be different, and we want to remain prudent through Christmas and beyond into the new year. But we will use the three tools that I've described to squeeze the virus in the weeks and months ahead: tiering, testing, and the rollout of vaccines, employing all three techniques together so as to drive down the infection rate. And I really am assured now that things will look and feel very different indeed after Easter. And that idea of an end goal or date is important, because at last, if the promise of the vaccines is fulfilled, we do have something to work for, a timescale, a goal around which we can all, businesses can begin tentatively to plan. But with luck, and with hard work, we will be seeing improvements before then. For now, the problem is not a shortage of hope or a lack of optimism, not with the amazing news that we're getting from the laboratories in this country. The challenge now, as we face this difficult winter ahead, is to fight down any over-optimism, to master any tendency to premature celebration of success. That success will come all the faster if we work together to follow the guidance, maintain the basic disciplines as people have done so heroically over the last few months. Hands, face, space, get a test if you have symptoms, because that is the way we will beat the virus together. I'm now going to hand over to Chris Whitty to say a little bit about where we are with the vaccine, and then to go to Andrew Pollard.
Thank you, Prime Minister. In fact, I was only going to say one thing, and that was an absolutely massive thank you to all of those up and down this country every day who are volunteering for studies into COVID, some in vaccines, some in drugs, some in testing, and many in just trying to understand the disease. Because as we've repeatedly said, it is only science that is going to get us out of this hole. And people across the UK are contributing enormously to this by volunteering their time, volunteering their expertise. Very large numbers of NHS workers, National Institute for Health research, NIHR workers, Medical Research Council workers, working with the academics and working with the companies. So it is only by this combination of science that we will defeat it. And I just wanted to thank people from all of us for this enormous thing they've done to help us and everybody get out of the COVID hole. But it will be a long haul. And the main news from today is the remarkably good scientific achievement of the Oxford AstraZeneca vaccine, and Professor Pollard is the person who really can best outline that. Andy.
Thank you very much, Chris. And it is, I think, a very exciting day for all of us. And we're hugely proud of our team in Oxford who's been leading this effort. But I think it's important to pay tribute to the 20,000 volunteers that there are in the trials around the world, and over 10,000 here in the UK, who've come forward in this uncertain time, feeling an absolute duty to play a part to help us get back on our feet and perhaps beat the virus. And of course, there's a lot of uncertainty in joining a clinical trial. And I think for all of us, having reached this point today, where we have evidence that the vaccine works, we have a huge debt of gratitude to all of those people who have taken part. Secondly, I just wanted to mention all of the researchers, and Chris pointed out that we have this amazing infrastructure in this country through the NHS and through the National Institute for Health Research, which meant that with 3 weeks' notice, I was able to contact 19 trial sites around the UK, and research nurses and doctors could come out of the woodwork and come and work on the trial to allow us to move so swiftly this year. And I think that's a unique situation that we have in this country that made it possible to do that. Our results today show that in our primary analysis, that's the analysis we agreed with all of the regulators, that the vaccine had 70% efficacy, which is fantastic. That's high efficacy, like we get with flu vaccines, and has the potential to have a really important impact on the pandemic, because we also, in the trials, saw no one go into hospital with disease or develop severe disease if they had been vaccinated. We also had these intriguing results, which you'll have heard reported in the media today, where one arm of our study had much higher efficacy, about 90%. That needs further work to look at it, but it's very exciting that there might be a way of immunizing with the vaccine that gives even better protection. Clearly from today, we have to provide all of the data to the regulators so that they can scrutinize that very carefully and decide whether it's appropriate to move forward for licensure. And we look forward to working with them to provide everything that they need for that purpose in the days and weeks ahead. And if they do approve it, we potentially, with the dosing regime that could be used, we may have more doses available than we thought. we have a vaccine that can be used at fridge temperatures. It can be stored at fridge temperatures. And for us in Oxford, this was really important because we want to be able to make sure that this can be distributed not just in a country like this where we can manage any form of distribution, but around the world, because the virus actually isn't just a problem here in the UK, it is for everywhere. And our partnership with AstraZeneca has been critical because they agreed with our vision for this of having a not-for-profit approach during the pandemic, so that no one was profiteering from making a vaccine in the pandemic period. And that does mean that part of what we can offer will be the equitable access around the world, which is absolutely the vision that there should be from a university. So I think it's been a great day today for us, and as Chris said, for science, that here we've, in 11 months, been able to pull together all of the data required, meet the requirements for regulators to be able to put that in front of them. And I hope that we'll be part of what could be the end of the problems that we're facing that you were just hearing about from the Prime Minister. I think in the meantime, we certainly need to make sure that we protect each other through this period of time and have access to the new treatments that are coming along. But with all of those together, I'm also optimistic for next year. Prime Minister.
Thank you. Thanks very much, Andrew. And let's go straight to questions from the public. We've got David from East London.
Thank you and good evening. Won't going back to a localised approach to restrictions again after the 2nd of December lead to variable increases in the rate of infections, with disadvantaged areas suffering the most?
Well, thank you very much, David. Obviously, we have variable increases and decreases going on right now, and one of the interesting things is that it's some of the areas that have been hardest hit, and some of the areas actually that have been the greatest deprivation, where you're starting to see some of the biggest declines in the virus. I think that's thanks to the work of communities in pulling together. I'm afraid that since the summer, regional disparities have been pretty obvious. What we started to see at the beginning of October, was really across the country, as we saw in much of Europe, a pretty universal second wave. What we want to do now is to push that R down. We think we've got it down to about 1 or just in that area now, but use this tough tiering to keep pushing it down across the country, and that's the best thing for deprived communities everywhere. But I wonder whether Chris, you'd like to, or Andrew, would like to comment on that issue as well.
Prime Minister, I think you've actually summarised it completely. The key thing is we need to make sure that people are in the right tiers, and then people adhere to the guidance. And if we do that, then we can keep things down. Thanks
very much. Andrew, anything to add?
No, nothing to add to that.
Thank you so much. Let's go to Debbie from Buxton. And I'm going to read Debbie's question. Will there be a plan to close schools an extra week early to allow a safe period of time before seeing elderly, vulnerable relatives at Christmas? Debbie, really excellent question. At the moment, we're not planning to do that. One of the things where we really attach as a country, as a society, a huge importance to is keeping pupils, keeping kids in school, keeping young people in education wherever we can. That's been at the heart of what we've been trying to do over the last few months. And it's meant that we've had to put a lot of pressure, sadly, on other sectors in order to drive down transmission. But we believe education is of huge importance. We want to keep kids in school as much as we can. Let's either, Chris, Andrew, you want to go on that one? Okay, then let's go straight to the...
I'll just add, Prime Minister, that I'm a paediatrician, and I've been working with the Royal College of Paediatrics group, and I think we're absolutely committed to the idea that children should be in school. And I think it's a very important point that you've made.
Thanks so much. Let's go to Fergus Walsh of the BBC. Fergus.
Thank you, Prime Minister. The rollout of this vaccine is going to be much more complex than the annual flu job. How are you going to guarantee that it's done smoothly and quickly?
Well, Fergus, you're totally right. And, obviously what we're doing now, even before we've got the approvals for any of these three vaccines, we're looking at exactly how we can distribute it, the immense logistical challenges. A large number of partners will be coming together to deliver it. The NHS, clearly, local authorities, the armed services, Public Health England, we will all be working together. They've all done an outstanding job so far, but there's a huge effort to go now. And that's why it's because it's such a big logistical challenge that's why I wanted to enter this important note of caution. We haven't got these things yet. Even when we do get them, it will take a long time. It will take a while before we can get the shots in the arms where they're needed. Chris, anything you want to say on that?
Well, the only thing just is to add to one of your points, Prime Minister. I mean, it is really critical we realise that the regulators have an absolutely critical next role. They independently will look at, do these vaccines work? And they independently will look at, are these vaccines safe? And only when they are satisfied, in the UK, the MHRA is an excellent regulator, and elsewhere, will it then be possible for us to say, for sure, we can roll these out and then have a plan.
Andrew, anything to add from your point of view? You've seen how difficult it can be to get vaccines on the market fast. Anything to add on that?
No, I think there's a huge logistical challenge, but there has been a lot of work in the NHS to start preparing for that. So I don't think we should forget about the efforts already going on and that they're putting in at the moment. Thanks
a lot. Let's go to Robert Peston, ITV. Rob.
Hello. Question for the Prime Minister and Chris Whitty. Gentlemen, when do you think that there will be no tiers and no government regulations constraining our social and economic lives? And if I may put a question to Andrew Pollard, if the virus mutates, how easy and fast would it be to adapt the vaccine to immunize against new strains in the way that we do for flu, for example?
Well, Robert, and it's still as Chris has just said, if we get medical clearance from the MHRA, if we can roll it out at a good lick, but roll both vaccines out, or all three vaccines potentially at a good lick, then with a favourable wind, we should. This is entirely hypothetical, but we should be able to inoculate. I believe, on the evidence I'm seeing, the vast majority of the people who need the most protection by Easter. That will make a very substantial change to where we are at the moment. And I don't want to give any more hostages to fortune than that. But that's the best information we have.
I'll just add to that, which is, I think the way we should think about this is science, and also the seasons when we get through to spring, will help to de-risk this infection steadily, step by step, and we'll be able to pull back from these really oppressive things we have to do socially and economically to keep it under control at the moment. The virus will not disappear, but it will become less and less risky for society, and we'll be able, in stages, to pull back to a point where actually it's still there. It may still cause problems, particularly in the winter months, but we're not having to do these things which cause such difficulties for everybody and such economic hardship for people.
So perhaps I'll take the question about the mutating virus. I think there is certainly the possibility of the virus mutating, and we need to have very good surveillance in place to watch for that. And that is already happening around the world to monitor the strains. But of course, at the moment, there are no vaccines rolled out. So the virus is not under that pressure to mutate away from the vaccines at the moment. I think if the question is, if it did happen, and we had no immunity against other parts of the virus, which I think is unlikely to be the case, But if that did happen and the vaccines were no longer providing protection, it would actually, for both the Moderna and Pfizer vaccine and our vaccine, it could be relatively quick. The actual scientific bit is a matter of days to change. And then, of course, there has to be some testing and manufacturing of the new vaccine. But really, the big step is a discussion with the regulators about whether you need to go through the full process again or whether you can switch quickly. And those discussions will need to be had. But at the moment, we don't have any licensed vaccines, so I think this is something for the future.
Thanks very much. Let's go to Tom Newton-Dunn, Times Radio.
Good evening, Prime Minister. Thank you very much. Question to Professor Pollard. Without wanting you to blow your own trumpet, because you're British and Oxford is British, although if you'd like to, I think everyone would like that as well. Can you say how better is your vaccine to Pfizer's in terms of capacity and distribution, obviously with the temperature issue? Is it just a better vaccine? And question to the Prime Minister and Professor Pollard as well, perhaps. We bought 100 million doses of this vaccine, but we're also signatories to COVAX, the Gavi project. Will we get priority? Will Britain get priority in getting our doses? Or will we have to wait with the rest of the world as this vaccine is shared around all the different countries who've signed up to COVAX equally?
And perhaps if I start, I mean, the important thing for having an impact on the pandemic is to have vaccines as early as possible. If we don't roll them out when we've got supply, whichever vaccine it is, then it'll take longer for us to get there. And for the world, even at this moment with Pfizer, Moderna and AstraZeneca, we don't have enough doses of vaccine. So I think the answer really to your question is that we need all of the vaccines. It's not a competition between them or which one's best. It's a question of we're only going to have an impact on the pandemic once people are vaccinated, and that's what we've got to get on with.
Yeah, and Tom, I think that we're doing a great thing by supporting the Gavi and the COVAX initiative. It's very important that the UK should be leading around the world in making sure that people get vaccines equitably in some of the poorest, neediest countries in the world. But we're also making sure that we have adequate supplies for this country, for suffering people in this country. And, thanks to the efforts of Kate Bingham, the Vaccines Task Force, as you know, we've got, for the Pfizer vaccine, I think we've got 40 million. I think we've done deal for 40 million by the end of next year, the Pfizer-BioNTech vaccine, and then for Oxford AstraZeneca about 100 million as part of the 355 million package. So we've got a huge. I hesitate to blow the UK's trumpet in any particular respect. I think we are at the front or near the front. In provision of vaccines. I think that the statistics probably would bear that out. Thanks. Let's go to Sarah Bosley of the Guardian. Sarah.
Thank you, Prime Minister. So it's fantastic news we have these vaccines. Are there any plans for certificates or so-called freedom passes to confirm who's been vaccinated once we've really got going on this? So, and if so, what could they be used for? And is there a possibility of any sort they could become compulsory in order to access certain places? And if I may, once we have got vaccination underway, what will the public be told they can do? If we've got one, for instance, that has 90% of efficacy, that does still mean that 1 in 10 will not be protected. But is there a danger that everybody will think life is back to normal and it's safe to go back to partying?
Well, Sarah, I'll ask Chris and Andrew to comment on your really very important question about vaccination and the role of the state. And let's be clear, there will be no compulsory vaccination. That's not the way we do things in this country. We think it's a good idea, and I totally reject the propaganda of the anti-vaxxers. They're wrong. Vulnerable people, people who need a vaccine, should definitely get a vaccine, and everybody should get a vaccine as soon as it is available, according to the advice of the JCVI, the Joint Committee on Vaccination and Immunisation. We should be very, very pro-vaccine. On your sort of your idea about the I think perhaps there's a confusion. What we're suggesting is there might be an interrelation between the tiering structure and the mass testing. And there, I think there is the potential to encourage people to get a test as a community and work together to squeeze the disease, as Liverpool did. And that was, it's been really encouraging to see how the people of Liverpool really came together. Large numbers took tests. We would like to see even bigger proportions of communities taking these lateral flow tests to establish whether or not they're infectious, because we think that could be a way of isolating the positive cases, helping to drive down the rate of infection, and so helping that area, that community, to move down the tiers to get rid of some of the restrictions. I hope that's clear. So it's an interrelation between the tiering and getting a test to squeeze the disease.
Shall I just start off on the vaccination, but I think Andy will want to add on this. I mean, in the first instance, the data so far is about whether the vaccine protects the person who has been vaccinated, both for this vaccine and for other vaccines. And you're absolutely right that no vaccine will be 100%, or almost no vaccine will be 100% protection. There is then a question, but that's very important, and that will significantly reduce if these vaccines come through the regulators and once they're in people's arms. This will reduce the number of people who die, the number of people with severe disease, the number of people going to hospital very significantly if we get good take-up. Then there is the possibility that any of these vaccines, and indeed new ones coming on, because there are many other vaccines coming through the system, including ones being trialled here in the UK, may actually protect people around the person who's vaccinated, because they make it very unlikely that person will either get infected or will pass it on. We don't know that yet. There are some early hints that might happen, and for some infections it definitely does happen. But we can't say that for sure. And if that's the case, then getting a vaccination not only protects you but it also protects your family, your friends, your work colleagues, those around you. But we cannot say that at this point until we have more data. But I think I would like to also just reiterate a point the Prime Minister has made. It is absolutely the case that either way, my advice would be, any medical practitioner's advice would be, these should be voluntary vaccinations, and people should want to take them because they will protect them from a potentially very debilitating and in some cases sadly fatal disease by these vaccines. But I think we need to be clear that there is this additional use that might come through, and Andy has got some early data on this from their vaccine.
Yeah, I mean, I certainly agree with the point that none of the vaccines are likely to protect everyone. But one of the interesting features so far across all of the different vaccines is they do seem to have stopped hospitalizations and severe disease. We only have limited data from press releases so far, but that's really what it appears to be. So it may be that the thing that we're really after, which is going back to the initial slogans about protecting the NHS, it may be that all of the vaccines can do that. What is harder is to prevent milder disease. And of course, most of the people in all of the trials that are being done have these slightly milder infections, which is the bit that we can measure the most easily because there are more of them. So when we see the efficacy levels, it is a mixture of dramatic impact against severe disease and slightly less dramatic impact against the milder disease. But all of the vaccines have high efficacy. The hint in the data, there's just a little hint in the data from ours, because we have this amazing setup here in the UK where we've been able to swab over 8,000 people in the trials every week. And so we can also pick up the cases of asymptomatic infection. And there's a hint in the data that in one of our groups that had the higher efficacy, we were able to reduce the amount of asymptomatic infection. And that may mean that there could be fewer people in the population who are spreaders. And that starts to stop the virus in its tracks if we can get there. But it's only a hint at the moment, and we need more information.
Thanks, Andrew. That's incredibly interesting and possibly encouraging. Thank you. Paul Waugh, HuffPost.
Evening, Prime Minister. You've announced today that the funding for Test and Trace will increase to £22 billion a year. That's equivalent to a fifth of the entire annual NHS budget. Do you think the current service offers anywhere near a fifth of the benefits of the entire NHS? And can you say how much of that new money will go on tracing as opposed to testing? And will the bulk of the tracing money go on local public health tracers rather than lining the pockets of private sector firms like Serco? And one for Professor Whitty. Public Health England suggested last week that for every 1 day of relaxation over Christmas, there could be 5 days of fresh restrictions. Have you got a current best estimate for what that ratio might be now? And have SAGE modelled the increase in cases and therefore deaths in a worst case scenario that could occur as a result of the loosening at Christmas?
Thanks, Paul. I'm just going to go back to some stuff I've been saying to you and to many others over the last few months about NHS test and trace. Yes, of course, a new operation like this, is going to have teething problems and difficulties, and there's no doubt that it has. And of course, people have been frustrated sometimes by the service that they've got, and I recognise that. Of course, I do. But look at what it is now achieving: a capacity of 500,000 tests per day. It's conducting hundreds of thousands of tests, and 37 million tests have now been done, more than any other European country. And you're right to raise the issue of collaboration with local authorities. That's integral to what we're doing, what NHS Test and Trace is doing. I think there are 198, something like 198 local authority teams. And as we go forward, the work of local authorities and others, we've mentioned the armed services, Public Health England and so on, will be crucial. I just want to stress, you say, is it value? It's of such importance and such value because if we don't have it, we can't know where the disease is prevalent in the way that we do. We have fantastic granular detail, which enables us to have this tiering system, this regional focused, locally focused tiering system that we've got. And it enables people who have symptoms to get a test and find out whether they've got it or not, and thereby to take themselves out of circulation. That's absolutely crucial. And the point we're trying to make this evening is that we can see the light at the end of the tunnel, but we're not there yet. We can see the oasis, but there's a long way to go. I mix my seasonal metaphors. There will be hard months ahead. We're going to rely very much on testing and tracing. And we're going to ramp that up. And the PCR testing is invaluable. The LAMP tests in NHS settings is also absolutely crucial to drive down infections in hospitals, nosocomial infections that played such a part in the spread of the disease in the spring. And of course, there's the whole lateral flow testing, the rapid turnaround tests that I also think can be of great value. Now, it would be a huge mistake now for us to de-emphasize testing at this crucial moment. If anything, we want to put more emphasis on testing, encourage people to get a test. Get a test if you have symptoms, get a test in your community if it's a high prevalence area, and help to squeeze the disease.
On Christmas, the thing I would add to what others have said is it is pretty obvious, I think, to anybody that the Christmas holiday period, the loosenings around that, which I think everyone welcomes as an ability for families to come together and all the things that go with the winter period, we all know that that is going to come at a risk. And the amount of risk of it depends on really three things. How seriously people stick to the tiers before we go into Christmas, making sure we keep the numbers keeping on coming down or stabilise at a low level, that people over Christmas take the opportunities but take them incredibly responsibly, and then they're coming out of the Christmas period. Again, people take this next period, which the Prime Minister's talked about, the period out to spring, incredibly seriously, and again, we are very mindful of the fact that if we start breaking all the rules, then we are putting other people at risk at a point of the year when these viruses transmit most easily and when the NHS is under greatest pressure. So it is absolutely essential people are really serious about this. In terms of putting a number on it, to be honest, I wouldn't put a number on it, because if people do all those things very seriously, we will have much less impact from Christmas, whilst people still being able to enjoy it, than if people choose to actually take a very much less public-spirited approach to it and go wild over that period. And so I think what we really need to do is we need to say, look, if everyone is serious before, during and after, then we can minimise the amount of impact it'll have. Of course, it will have an impact, and that's accepted. And this is all part of the balance of having to keep the virus under control, but trying to do so in the way that is the least socially and economically damaging. It's a very difficult balance, as we all know, for which there is no perfect answer. It's trying to get the balance as best we can between these competing difficulties.
Thanks so much. Thanks, Paul. Let's go to Talk or Cry from the Daily Record.
Good evening, Prime Minister. What is the score of the Christmas holidays? Final agreement seems to be stuck in a kind of no man's land between you and the devolved governments. Nicola Sturgeon wants a small number of people to meet for a small number of days. Fewer days than you, perhaps. Is the devolved tail wagging the Westminster dog here? And what are the chances of a bit of peace and goodwill between the two of you?
Well, Talk, I think there's, as ever, the absence of peace and goodwill is grossly overstated by those who might have reasons to do so. Actually, there's a very good discussion going on between us and the DAs about how to do this. Everybody obviously has relatives in all parts of the country, and we want to make sure we have a solution for Christmas that everybody can share and understand and respect throughout the whole of the UK. But to get to your characterisation, I think everybody shares your caution. We want people to be able to celebrate, but we don't want to ruin it by overdoing it. So that, I think there's a wide measure of agreement about that, and I think you could probably expect some news about the way forward pretty soon. Talk. Okay, everybody. Unless there's anything that anybody wants to add.
Prime Minister, can I just add on that last one?
Chris,
I mean, I have the privilege of working very closely with my opposite number chief medical officers from Scotland, Wales and Northern Ireland. And in fact, the last meeting I had before this press conference was with them to discuss Christmas. And we learned from one another. That's what it is. It's all about us learning from one another and actually bringing the skills across the UK to bear to actually learn about this virus and try and achieve the best outcomes for the public.
Thank you very much. Thanks for what we're all doing. Thank you all, and see you next time. Thank you.
And there we have it, the latest news conference led by the Prime Minister. Our political editor, Beth Rigby, is here with me. And the message coming from that is about balance. So, yes, lockdown is lifting. There are vaccines potentially on the way. But, still got to be careful.
I mean, my takeaway from that is that this is going to be a long old run until we can live in a more normal situation. I mean, the Prime Minister there was saying that his end goal is Easter. That's in April. That's 4 months away. So, yes, the English national lockdown ends on December the 3rd, but we are going to be in tougher tiers. More of the country will be in the higher tiers. It will loosen up a bit at Christmas, and then we're back into that system right through January and February, April is the moment that the Prime Minister is saying that we could go back to a normal life. Look, there was hope there. Of course there was. The vaccine news is absolutely brilliant, very positive. And the Prime Minister there was saying with a bit of speed and favourable headwinds, then it could be that everyone that needs a vaccine might be able to get that vaccination by Easter. So that is a great balancing to what is going to be a tough few months. But I also thought it was interesting what Professor Whitty said right at the end there, because the Prime Minister characteristically made light of it, saying Christmas is a time to be jolly, but this season we've got to be jolly careful. I mean, a clever play on words. And Chris Whitty there saying it's pretty obvious that loosening restrictions at Christmas come at a risk. And that risk depends on how people behave before, during and after Christmas. And he said it's absolutely essential. People are really serious about it. And I think, we might get what the Christmas plan looks like tomorrow at the earliest. As I said, the Prime Minister needs to get that signed off with all the devolved administrations, and then people are going to have to make their own judgment calls about how many people that they want to have around the table. I mean, it could be that you can have up to 3 households gathering. We expect the period could last for about 5 days. This is all to be signed off, so I'm heavily caveating it. But people will have to take their decisions. But, you know, the vaccine is positive. Also, the Prime Minister talking there about testing, speeding up testing, and perhaps we can get some more freedom around that. But in the short term, into Christmas, it's going to be tough. And then January and February, at the peak of demand for the NHS, I think it's inevitable that we're going to be living with quite tough restrictions.
Hard, cold months ahead, as the Prime Minister said. Beth, thank you very much indeed. Well, let's remind you of exactly what has been announced, some of the main subjects that were discussed there. Non-essential retail will be allowed to open across all 3 tiers. That's, of course, a big boost to Christmas and post-Christmas shopping. Outdoor grassroots sport will be back on, with gyms being able to reopen in all tiers, 1, 2 and 3. The 10 p.m. curfew for pubs and restaurants will be extended until 11 p.m. in tiers 1 and 2, but in tier 2, only pubs serving meals can open substantial meals. Pubs and restaurants in tier 3 will only be able to offer a takeaway service, and all other hospitality and indoor entertainment venues must close. All places of worship can reopen across all 3 tiers. Those in tier 1 can interact with up to 6 people, but those in tier